Welcome to Healthy Heart. This is Dr. Isaac Opoku-Asare and my producer, Mr. Blay. Thank you for joining us this evening for a discussion about the cardiac and the vascular system. Over here, we'll talk about both because they are linked together, and it's not enough to know about only the cardiac, and it's not enough to know only about the vascular. It is important for you to know both. And today we'll continue our discussion that we started last week, which is the vein diseases of the legs, specifically chronic venous insufficiency. And as we always do, we will like to go to the pillars of ideal cardiovascular health, because as we learned last week, that even in the case of venous disease, these issues of ideal cardiovascular health plays a significant role. Why did we say that? Because we know that obesity is a big contributing factor to having vein disease in the legs. So controlling your weight will go a long way to ensure that your veins that are in the legs are very healthy. So that is why we cannot have this show without going through the pillars of ideal cardiovascular health. And today we'll be talking about the treatment of the vein disease of the legs. And if you've not had the opportunity to listen to our discussion on the various ones, we will strongly encourage you to go and listen to the discussion that we had last week so that you'll be able to understand or appreciate what we're going to talk about today. So let us go to the pillars of ideal cardiovascular health. Once again, as I said, the three fundamental ones, there are 7 of them, but once again, the 3 fundamental ones, physical activity. I can overemphasize that. Physical activity, that is walking for at least 150 minutes. And this is leisure time walking. I'm not talking about work-related walking. Those ones do not count. I mean, I say do not count in that it is believed that everybody should do that. But we're talking about setting time aside to either walk or to jog, to run. Such an activity is what we're talking about, which we believe will go a very long way to help you. And it is very simple, 150 minutes a week. And you can decide to do it over the weekend. If you decide to walk an hour and a half over the weekend for 2 days during the weekend, that is either Friday evening or Saturday evening, you've got your exercise regimen, that your exercise requirement that you need. And the second part that is also important in the 7 pillars of ideal cardiovascular health is appropriate dietary patterns, making sure that you're eating food that is rich in vegetables, food that is rich in fruits, less in red meat, and also a good amount of nuts, and more importantly, avoiding trans fat. We talked about trans fat. You can go and listen to our video session on YouTube and other platforms. So avoiding trans fat and making sure that you consume unsaturated, either poly or mono unsaturated. What are these ones? I'm talking about the extra virgin oil, canola oil, the vegetable oils, the oils that do not settle. These are the good oils that you must consume. And then we talk about nuts and fish. Nuts and fish are very good because they have high concentration of omega-3 fatty acids that are good for you. So appropriate dietary patterns is important, because they give you the macro and the micronutrients I believe that you need to be able to have an ideal cardiovascular health. And the third one in these pillars is appropriate calorie control. Appropriate calorie control goes with your weight. It's the same thing. They are all the same. I've never seen anybody fast and gain weight. It doesn't happen. So for me, the critical element to be able to control your weight and control your calorie, for me, number one is intermittent fasting. We did an excellent thing on intermittent fasting, which I will recommend that you go and look at it. You can lead your life in such a way that you can eat once a day. And when somebody tells you that you can eat once a day, you may think it's impossible. But I can tell you that you can do that. Lions, these are the most powerful. They are the king of the forest. they eat once a day and they don't die, they live well. So intermittent fasting is not fluke. It's been published in New England Journal. It's not because it's a New England Journal, but it's because we know it works. I have practiced that, and it's a very, very powerful tool to control your weight. There is no rule in this world that as an adult you should eat 3 square meals. I can tell you that. If you can at least use the 5-2 formula. Once again, you can hear that on our system. The 5-2 formula, where at least 2 days out of 7 days, you reduce your total calorie intake to 500. That will go a very long way to help you. But if you cannot do that, I tell people, if you can ensure that in between your 2 meals, there is a minimum of 8 hours in between your 2 meals, that will go a very long way to help you. If you can achieve 12 hours between your meals, that is even more fantastic, because the benefits of intermittent fasting comes after you are able to stay away from eating around 8 hours. So that is why the critical time of 8 hours to 12 hours will go a long way to help you. So these three things are critical and important pillars of ideal cardiovascular health. Once you do them, talking about exercise, we're talking about the calorie control, and then we're talking about the appropriate dietary pattern. Then that would go in a long way. There are certain factors that are at play. So doing these things does not mean that it's never going to happen, that your blood pressure may not be high. But with other things, you can ensure that your blood pressure is less than 130/80, and your cholesterol level is less than 200. That is over simplification. Once again, you can go and listen to the videos that we have on that. And your blood sugar is less than 100. So, and avoidance of smoking, which I believe that most people do not do. Smoking of cigarettes is probably one of the most useless things anybody can do in life. Why am I saying that? Because smoking cigarette is like buying disease.
This episode is sponsored by Zenith Christ Family Chapel. ZCFC is a scripture-based church located in Spencerville, Maryland. Join us every Sunday in person or live on YouTube at 2:30 p.m. Eastern Standard Time. God bless you.
There is absolutely no benefit in smoking. Absolutely none. There are few things in life that has no benefit. Almost everything in life has a little benefit and and a little good. Smoking has none. It only buys you cancers of the lungs and problems like that. And that is why you really want to stay away from them as much as possible. And for the young people, you need to stay away from the vaping. It's not going to help you in any way. So once again, these critical elements of ideal cardiovascular health are something that we always want to remind you. Every day, push yourself towards better numbers. That is, at least have. It is known that people who have more than 4 of these ideal cardiovascular health numbers will have a 60% chance of living longer compared to people who have none, or people who have less than 4. So it is important that every day you look at yourself and see how many of these things do I have, and if you have none of them, then at least practice the first 3, which is appropriate exercise, calorie intake, as well as the dietary patterns, which will probably help you to be able to get the numbers that we're talking about. So we'll go for a short break and come and have a discussion that we will continue a discussion that we had on treatment of venous insufficiency of the legs. There are vein diseases in other parts of the body that will come and talk about it. But this is, I am a board certified endovascular specialist, and we can really talk about that, and I believe that it's going to go a long way. So we'll go for a short break, and then we'll come back and give you the opportunity to call somebody to listen to us. Once again, this is Advanced Cardiovascular Institute, and this is Dr. Isaac Opoku-Asare, the Chief Medical Officer of this place, and we're coming to you with this program, hopefully, to help you to be able to make appropriate decisions in your health. So I can go back. Mm-hmm. So thank you very much. As we talked about last week, we said that there are various manifestations of vein disease of the legs and it comes in the form, as you can see, it comes in the form of spider veins, telangiectasias, and it also comes in the form of varicose veins that you can see on the legs. And these things have, let's put it this way, they have cosmetic implications, but that is what sometimes people think. It goes beyond that. It is a sign that something is happening. And if you look at the picture that we're showing you now, you could see the normal vein where the blood is flowing up. We've talked about the fact that the role of the veins is that they take the blood back to the heart. And you look at a disease vein where instead of the blood going up, part of the blood is coming down. And there can be various causes for that. You know, as I said, obesity is a huge factor in causing that. And people also have genetic predispositions that causes you to have this. And so it will manifest in this form of, as I said, the minimal stages or the mass stages of it will be varicose veins, spider nevis, or telangiectasias. But they can progress, and as they progress, they lead to things like swelling of the legs. A lot of people, I'm picking this up left and right. A lot of people have vein disease and they don't know. It is believed that probably one in every third person, especially in a woman, may have vein disease, but they do not know. And it presents itself in, this is how sometimes it presents itself in achiness, heaviness of the leg, cramps at night, and tingling sensations that occur in the legs. So your legs, if you are experiencing some of these symptoms, it is important that you talk to your primary care doctor to get a referral to a vascular doctor for you to be appropriately evaluated. I mean, endovascular person, and this is in all forms of specialties. Even women after pregnancy, we see this all the time because of the fact that the baby's head rests upon the veins that are in the pelvis. It can lead to that. And most people may have the mild form, but a significant amount of people may have an advanced form, and these present in a form of swelling of the legs. During the day the legs are good. By the time that you come back at the end of the day, legs are swollen. Sometimes for the men, a guy came to me, he's wearing a socks, and when you take the socks off, it's almost like somebody has drawn a ring around his leg. And I asked him, why do you think it is that? I pressed it, and when I pressed it, my entire thumb could go into his leg because of how much swollen is it. And when a guy came to me 2 weeks ago. He's been increasing the size of his shoes. And I asked him, why are you at the level, being an adult, why should you be increasing the size of your shoes? Something is happening. You are not no longer a child. And it's all because progressively, what has been happening to him is that his legs are getting bigger and bigger and bigger, and he's developing progressively worsening vein disease. Welcome to Advanced Cardiovascular Institute and White Oak Cardiovascular Center. This is a place that you can be assured of evidence-based, patient-centered, and compassionate care. What does it all mean? It means that when you come to Advanced Cardiovascular Institute and White Oak Cardiovascular Center, we do not see you as a patient, but we will see you as a member of our family. Therefore, we treat you the same way we treat our family members. That is why at this place, we have taken measures to make sure that you are being treated with the highest care, and more importantly, with people that are qualified to do what they are supposed to do. If you look at our rooms, you realize that we've made room for any condition, including whether there is a pandemic or not. Additionally, you also see that we have a staff that also cares for you. So as you come here, we don't see you once again just as a patient, but we'll see you as a family. And if you do not take care of it, then what happens is that you may end up with skin changes and ultimately with ulcers of the legs. And as we said the last time, the commonest cause of an ulcer on people's leg is vein disease. I'm repeating this. The commonest cause of ulcer on people's legs is vein disease. And that is why taking care of the vein disease is paramount and important for us. So how do we do it? As we will show you in this picture, the first thing that you should know is that you have to apply compressives. Compressive stockings is critical, especially if your doctor has done an ultrasound. I strongly believe that if you have evidence of vein disease, you need an ultrasound to establish whether it is due to a blockage or the backflow, because sometimes it can be a blockage of a clot in the vessels that is causing that. But most of the people is because of the backflow that we showed to you, where instead of the blood going up, the blood is going down. And as you see in our picture, the picture we showed you of all the people, the vein that is tortuous, that you saw that tortuous vein in that person, the tortuous, the you saw that it is here that you see the picture that it instead of the blood going up is going down. We'll show you another picture where you see that you see the normal vein goes up and the other the disease vein is tortuous. So that disease vein that is tortuous is the reason why. You see, just think about it. It's easier to drive on a straight road rather than to make a bend. And whilst you try to make those bends, that is where you end up with. That's where you end up. So we'll come back to that picture again of that. You see two veins. They are in blue. You're going to see the straight one. You're going to see the curved one. Pay attention to this very well. You see that the normal thing is the blood that is going up. It's white in both blood vessels. But you see a red arrow, the blood coming back. And as you see below, it's somebody wearing a socks. Why is that important? Because the first treatment of it is compressive stockings. The compressive stockings will do it will not straighten the muscle, it will not straighten the vein, but it will keep the blood from returning as much as possible. No matter what I am going to say here, almost everybody, you will need a level of compression. That is why wearing the compressive stockings is important. So that is the first treatment. And as I said last week, that you need to be able to wear the compressive stockings appropriately. It's difficult, but based on it's difficult to wear them, and that's why people don't wear them. So generally, I start at a level that the patient will tolerate, and as we move along, then wear it. Ideally, you should be able to wear the compressive stocking a minimum of 12 hours during the day. You don't wear the compressive stockings whilst you're going to sleep. And I tell people that you can decide to take your shower in the night, and then early in the morning when you get up, you wear the compressive stockings. There is a patient of mine that he goes to brush his teeth, he does everything relaxed. When he's about to leave, then he wear the compressive stockings. You know what happens? By the time he was leaving home, all the blood has come back into the legs. And he tells me, by the time I'm about to leave home, the legs are swollen. I say, yes, it's because you should wear the compressive stockings as quickly as possible to be able to give you that effect. So if the compressive stockings is not able to control the signs and symptoms, what are the symptoms that you're going to have? Achiness, cramps, heaviness in the legs, itching, and tingling sensation. If these things are still occurring, despite the use of the compressive stockings, then we come to certain intervention that must be done to prevent or close those blood vessels that are causing the blood to come up, especially in the case of the reflux. So you're going to see that a doctor, we're going to show you a picture of it. This is a very minimally invasive procedure that is done by many doctors, and the complication rate is generally on the low side. As you see the doctor over here, the doctor will get an IV line, and you see that with the IV line, they will go in and then be able to close the vessel, the veins that the blood is flowing through back. So think about it. The blood is flowing through the diseased or the incompetent, the valves with the veins with incompetent valves. And when you close those veins, then the blood will not be able to come back. And that is why you see that picture, the picture of the doctor. This is almost the same thing. Almost every vein procedure that is going to be done you see that we start with getting an access. And once we get the access, how what do we mean by access? They put in an IV line, and the various procedures can be done. The procedures that are done to close the veins are in two forms. One where they use a form of energy, and other ones they use a liquid. All of them have their plus and minuses. So we're going to talk about the two that uses we'll call them thermal. That is, they use a form of heat. It's not necessarily the word. When I say thermal, it's like heat, but you don't feel any heat. So let's look at the first one. The first one is laser. And you're going to see, we'll show you a picture. The doctor has got the IV, they get the IV line, and then he's going to pass a catheter. You're going to see the picture of a laser one that is done. Whether it is laser or radiofrequency ablation is going to be the same. So you're going to find that the legs are there, and there are pictures of the beginning of the process. That you're going to see the beginning of the process where you will see so this is the laser. This is the same laser that we use. You see, you look at this particular individual, the doctor will get the IV line, and then what the doctor does is that he's going to give you medications around the vein. We'll call it tumescence. And after that, the doctor will go take the laser to go through and deliver the laser, and the laser will close off the veins. And you realize that the person who had all these veins on the leg, because the blood is not flowing back, at the end of the day, it doesn't happen immediately. This is probably a few weeks, and after that, you see most of these things that you saw on the leg go away. The results are not always like that. I want to stress over here, because sometimes the doctors may give you too much hope about this, because the patient will say, I've been treated. It doesn't happen that way. Once we actually use the laser to go in and then close off the main blood vessel that is causing it to flow back, these other ones will close off, and then you continue to wear your compressive stockings and you do good. So this is laser. We're going to look at another picture where we use radio frequency ablation. The same principle applies again. So they will get an IV line as you see them, and after IV line, they will give you a medication, sort of anesthetic around the blood vessel, and then they will use a radiofrequency energy to go in and then close off the vessel. This is a procedure that takes less than 30 minutes, and you should be able to go home. I mean, most of the time, you should be able to go home just after the procedure. You walk, the patients can walk without any significant limitations. Your leg will be wrapped, and you continue to wear your compressive stockings, and the blood vessel, the vein that was open, causing all the blood to come to your legs, they'll be closed, and hopefully you're going to have the similar results as we saw with the laser. So whether you are using, the doctor is using the laser or the doctor is using the radiofrequency ablation, it will close off the vessel, and then the blood the blood that is flowing back will no longer be able to have a channel to come back, and hopefully you end up getting the results. So let us go to other ones where it's non-thermal, where they don't use either radiofrequency energy or they don't use laser energy. So the common one out there is you go to the doctor, and the doctor is said that we're going to use a medication called Varathina. Varathina is a foam that has been made to in such a way that once they are delivered into the veins, once again the doctor will get an IV line, and they are delivered into the veins, what you're going to see is that the leg will be wrapped, and you will go home with that, and the blood and the veins will close, and then the blood will not be able to come back again. This is a very good therapy that helps in patients, especially those who do not want, patients who want very, very minimally invasive approaches. Why is that important? It's very important that you know the distinction, because for the ones that they deliver the energy, they need to inject an anesthetic around the blood vessel, and certain patients will not like that, and that is why this particular foam, which is currently by Boston Scientific called Varithena, can be injected into the veins, and then it closes off the veins. Almost all the vein procedures have a small risk of having a clot in the blood vessel. And it is important that after the procedure is done, your doctor will do another ultrasound again to ensure that there is no clot that has been formed. Most of the clots are minor, you don't need to do anything. Sometimes the clot may be a little bit more, and you may have to take a blood thinner for a few weeks to ensure that the clot is gone. So there are the three levels of the clot most of the time. The first two is not something that worries us. The one that worries us most is when they get into the deep veins, and that is why you may have to do something about that. So apart from the foam, and there are doctors who make their own foam, and that has also been found to be good. So another one is what we call the mocha. As you see in this picture, not only do they give the foam, but they also end up giving you. They use a small device, to bring the veins together, and in so doing, they can close it off. So the mocha is also another means where your doctor can use it to close the veins. Once again, the legs will be wrapped, the veins will come together, and that is going to help you. So you're going to see the picture. We'll show you the picture. The mocha is what we'll call, the doctor will tell you that we're going to use a Venosil. The Venosil is the name that the doctor is going to use. The other one is Varithena, which is a foam, and the Venosil is this one. And we're going to show you the pictures of how it looks like before. So you're going to see this device lying there, and in the vein initially, and once the device has gone through, the blood vessel is closed down, the vein is closed down, so that you no longer have the reflux that or the backflow that is causing the problem. So when these things are done, these are the major ones that are done. When these things are done, this is a picture that this is what the patient will, in the long run, be expecting, or this is what we expect to happen. It's not always 100%, and it's important that as a physician, I set the right expectations for you. This has to be done in one leg at a time. So sometimes patient will ask, are you going to do both of them in the same setting? It is important for you to know that that is not the case. So we're going to show you a picture of a patient, a patient who had the procedure done at the beginning and had the procedure done at the end. This didn't happen over one day. I just want to repeat this. After the first day is going to be like this, but over the next few weeks, sometimes the results can be pretty impressive. But let me repeat this way: this does not always happen, but in a large majority of patients, you're going to end up with these results. It may not take only one treatment to be able to get it done. May have to treat the blood vessels and then come back and treat the other ones. So there is another part that we did not talk about. I did not make it part of our discussion because for people who have spider veins and a little bit of varicose veins around, in that case, you can do what we call sclerotherapy, where the doctor can inject something into it. And when the doctor injects something into it, it will make those ones go away. We call it sclerotherapy, that they can deliver to that. And a lot of people can offer that because it also makes the legs cosmetically better. But we are talking not only for just the cosmetics, but it is beyond, it goes beyond that. So having treated the medical aspect, we believe that it's also good for the legs to look nice. And if there are other little spider nerves and other things, the doctor can also look at that and then treat them accordingly. So in broad terms, as you see in the picture that we showed you, over here. Once again, look at this very, 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 it's not pleasant to look at this bulging varicose veins, and then at the end of the treatment, look at how the legs look. It is pretty impressive. If we can achieve such a result, even if we are not able to achieve such a result, at least we know that the achiness and the cramps and on the other ones, most of them may go away. So back to the prevention. The prevention is determined here by, what did we say? A number of things go into place. Lack of activity, sedentary lifestyle, number one. Obesity, number two, right? And there is some family component. And people who do this, I can tell you this, people who do jobs that stand for a long time, and people who do jobs that sit for a long time, I'm telling you, if you sit for 8 hours in a day, go and work for 1 hour to reverse it. So, and talking about jobs where we sit for 8 hours is many, 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 many jobs. And that is why you see the particular group of people, there are certain jobs that I've seen where it is pretty common in them. And I've seen this in a lot of nurses. I've seen this in people who do office work that sits for a long time, and they are not aware. But it is important, and they keep on figuring out why is it that my legs are aching, and they realize that they have a lot of numbness in their legs and other things. Sometimes it's a vein disease, and it needs to be checked. And as I said, if you are able to get it done and also do the preventive part of it, it will go a long way to help you. There are other vein disease like pelvic vein disease, which we'll come and talk about it. But we would like to stop at this point for vein disease of the legs. And then next week, we'll be talking about glycemic index. Glycemic index is a huge, huge topic, and invite people to join us because I believe that is going to go a very long way to help you. So once again, I want to say this. It is believed that 1 in probably 3 women have got a vein disease, and probably a significant amount of men have vein disease. So if your legs are swelling, if your legs are aching, if your legs, you have having numbness and night cramps or tingling sensation, it is important to find an endovascular expert or talk to your primary care doctor about that. Be evaluated, exercise, lose the weight, and avoid sedentary lifestyle, which I believe will go a long way to help you. God bless you very much, and God bless all our listeners. We encourage you to bring others to join to listen to us, and hopefully we'll be able to hear from you either in messages or in letters to allow us to know what you're interested in, to also encourage us to continue this work that me and my producer, Mr. Blay, have been trying to bring to you week in and week out. Thank you very much, and good night.
Thanks for listening to God's Rhythm. Tune in every Monday and Thursday at 10 a.m. Eastern Standard Time to learn how to protect your heart. God bless you.